Greetings, my name is Kelly O'Neill. Mindy Bryant and I have partnered together to present to you Dorothea OREM'S self-care model. The contents of this presentation includes background on Dorothea OREM, Mindy and I's origin of interest, an in-depth look at Miss OREM'S self-care model, a discussion about the relevance to nursing practice as well as limitations, and an overview of future directions for use in nursing practice. To begin, we will discuss Dorothea OREM'S background and origin of interest. Miss OREM, a Baltimore, Maryland native born in 1914, earned a nursing diploma and a BS in nursing education in the 1930s. In 1945, Miss OREM earned a MS in nursing education and first published her concept of self-care in 1959. From 1959 to 1970, Miss OREM held a variety of professional roles at Washington, D.C.'s Catholic University, including the Dean of the School of Nursing. She went on to become a curriculum consultant at universities such as Johns Hopkins, associations, and government agencies like the U.S. Department of Health. In 1971, Miss OREM published Nursing Concepts of Practice, which outlines her self-care nursing theory. Nursing Concepts of Practice is now in its 6th edition and has firmly established Miss OREM as a leader in nursing education and nursing practice. Mindy and I were originally interested in Dorothea OREM'S self-care model because it is considered a significant contribution to nursing education and the profession of nursing. Once we further researched the theory, our interest deepened when we discovered Miss OREM'S theory is widely used in a variety of settings, particularly clinical settings, and the self-care model became even more interesting when we discovered the theory is patient-focused and promotes recovery and healing. Next, we will review Miss OREM'S self-care model. In 1959, Dorothea OREM first published her concept of self-care. In that initial publication, Dorothea OREM outlined the origins for her self-care theory by writing, "Nursing is perhaps best described as the giving of direct assistance to a person as required because of that person's specific abilities in self-care resulting from a situation of personal health." Mindy and I really liked this quote by Dorothea OREM because it focuses on the patient's abilities rather than their limitations. Dorothea OREM'S self-care model consists of 3 interrelated theories: the theory of self-care, the theory of self-care deficit, and the theory of the nursing system. The first component of OREM'S self-care model is her theory of self-care, which has 4 parts: self-care, self-care agency, self-care requisites, and therapeutic self-care demand. Self-care evaluation begins with a nursing assessment to identify activities that the patient initiates and performs independently to maintain life, health, and well-being. Next, the nurse assesses the patient's ability to engage in self-care, taking age, gender, environmental factors, and others into consideration. Next, self-care requisites, or activities of daily living, are assessed in relation to universal, developmental, and health deviation requirements. Finally, the need for therapeutic self-care demand is assessed. This evaluates total care activities needed to meet individual self-care needs at the moment or even over a period of time. Moving on, the second component of OREM'S self-care model is the theory of self-care deficit. In this theory of self-care deficit, needs are identified and 5 methods of helping are considered. During this phase, the nurse confirms the needs and limitations of the patient. Once the needs and limitations are confirmed, the nurse begins to consider implementing OREM'S 5 methods of helping, which include acting and doing for others, guiding, physical and psychological support, promotion of personal development to meet future demands, and teaching. The third and final component of OREM'S self-care model is the theory of nursing system, which defines the role of the nurse and then classifies the nursing system. OREM'S theory of nursing system outlines how the patient's self-care needs will be met by the nurse, the patient, or both. OREM identified 3 classifications of nursing system to meet the self-care requisites of the patient: the wholly compensatory system, the partially compensatory system, and the supportive/educative system. Patients requiring the wholly compensatory system have the most limitations and require complete care. Patients needing the partly compensatory system have some limitations, but are able to perform some requisites independently. Patients requiring the supportive educative system are independent and simply need education to further promote self-care. Next, we will discuss the relevance of Ms. OREM'S self-care model to the practice of nursing and also address limitations. OREM'S theory of self-care is relevant to an outpatient spinal surgery clinic like the one where Mindy works. Patients at the outpatient clinic undergo spine surgery, and it's Mindy's responsibility to assess the patient prior to surgery to ensure they understand the procedure and the recovery. OREM'S theory of self-care is relevant to this assessment, as Mindy will be determining self-care activities, self-care ability, and self-care requisites. Limitations are to be expected following surgery, and OREM'S theory of self-care deficit is relevant to such limitations. To address limitations, Mindy will develop a plan of education for the patient to meet their individual needs and establish postoperative assistance as needed, which is a component of OREM'S 5 methods of helping within her theory of self-care deficit. Mindy will then use OREM'S theory of nursing system to implement compensatory or supportive care post-surgery to address the patient's self-care needs. There are limitations to Ms. OREM'S self-care model. While it is comprehensive, it does not assess the patient's emotional needs. For instance, self-care requisites are physical and the emotional needs are not addressed. Additionally, Ms. OREM'S theory is illness-oriented, which makes it less applicable in certain settings. Finally, we'll review the future directions for use in nursing practice. To resolve the limitations of OREM'S self-care model, the self-care theory should be expanded to include assessment of emotional limitations and needs. Doing this in the future would result in a more holistic assessment. Additionally, in 1991, the International OREM'S Society was founded. This society should be supported in the future to encourage future research, fund future nursing education, and promote future development of Ms. OREM'S theories of nursing. These are our references. And we want to thank you all so much for looking at our presentation. We hope that you found it informative and interesting. Please let us know if you have any questions or any feedback. Thank you.